Thank you. All right. Welcome. Thank you for being here. My name is Dr. Phil Harrington. I am the medical director for Sumis Medical Laser, but I am also a 1996 graduate of Palmer College in Davenport, Iowa. Palmer, of course, being the foundation of chiropractic, the fountainhead of chiropractic, and it was at the corner of 2nd Street and Brady where Daniel David Palmer gave the first chiropractic adjustment to the janitor Harvey Lillard, thus restoring his hearing. You see a couple of pictures there of me with philosophy instructor Victor Strang, Dr. Victor Strang, and our peripheral neurology instructor, Dr. Gio Schmidl. They were two longtime professors at Palmer College. And so when we have children, we want them to have roots. We want them to be based in faith and morals and values. We want them to be based in family traditions. But we also want to give our children wings. And the way I vision this is that I want to always stay true to the principles of chiropractic. But I also see Class 4 laser therapy as giving us wings so that we can do more for our patients. And so whenever I speak on this topic, I always share my vision. And my vision is that Class 4 laser therapy will be an integral modality in all fields of healthcare all over the world. When Dr. Richard Albright founded our company, we started in chiropractic. I'm a Palmer graduate. He is a Life graduate. We knew how laser therapy would work in chiropractic. Shortly after we launched the company, some men approached us about the use of lasers for animals. And a little bit of a silly story, they asked us, will the laser work on arthritis in dogs? We did not know any better. We asked them, do dogs get arthritis? Well, fast forward, now Class 4 laser therapy is standard of care for many veterinary applications. But we also see the lasers being used by many athletic trainers and sports teams, including around the world, the New York Yankees, the Slovenian men's basketball team, and the Malaysian Olympic team. And we are seeing more and more applications for Class 4 laser therapy. So when we do the treatments, the presets are set in the machine depending on the body part that we're working on, the particular problem, the size of the patient, their skin tone, their pain level. So treatments are very, very easy to do. The treatments are non-invasive, pain-free, and there are very few contraindications to the treatment. A look at the history of this modality. And I know you may not be able to read that, and that's okay. There have been dozens, if not hundreds, of different terms to describe the application of light to biological tissue with the intent of having a positive effect. It was called cold laser, low-level laser, all of these different terms. Thankfully, in 2015, a group of experts from around the world decided on the term photobiomodulation, and you see the definition there. With these treatments, we are using red and infrared laser light, which is non-ionizing, and therefore the treatments are very safe. So photobiomodulation refers to that absorption of a photon of light by cells, different components in the tissues and in the cells that have a modulating influence. Modulation means that if some things are overactive in the body, it will bring them down to a normal level, and if other things are underactive, it brings them up to a normal level. So when we look at the basis of chiropractic philosophy, that the body is a self-healing organism, photobiomodulation can play a role in simply helping the body to heal itself more efficiently. This is a slide that I have borrowed from my friend and laser researcher, Dr. Praveen Irani. And it goes through in depth the explanation of the mechanism of action for photobiomodulation. When I started to use this technology in my chiropractic office in 2005, the only thing I knew about laser therapy was the patients came in pain, I lasered them for a while, they were pain-free, and they walked up to the front and they paid for it. And I like to get paid. Now, thankfully, in the 20 years since then, there have been experts around the world that have determined the mechanisms of action for laser therapy. And just to quickly go through those, when we have the absorption of the photons of light by the cytochrome C oxidase enzyme in the mitochondria, we have trillions of cells in our body, hundreds of mitochondria in every cell. So having that direct influence on the cytochrome oxidase enzyme helps facilitate the production of ATP, adenosine triphosphate energy in the cell. So if the cell can be more energetically active, then the tissues, the organs, and the organism will be healthier. There are also downstream effects that happen from that. So if the topic of mechanisms of action interests you, I can refer you to papers to read on that in more depth. There are also photoreceptors on the cell membrane surface that have a direct influence on the ion exchange channels, as well as the calcium pump to allow the influx of calcium for the production of ATP. And then we also have extracellular effects happening that will enhance tissue healing. So again, if you notice on the bottom, if we have processes in the body that are overactive, such as pain, inflammation, or aberrant immune responses, the laser treatment brings them down to a normal level, while at the same time, if we have things that are underactive, tissue healing, wounds, etc., the laser will help bring them up to a normal level. This understanding of the mechanisms is very important in three ways, and those are, it gives us greater acceptance from the healthcare community. So when we started using lasers in the United States in chiropractic, and we would talk with other healthcare providers about the therapy, they would be very skeptical. First off, they would look at the list of all of the names that it was called, and they would say, well, if you can't even agree what to call it, why should we believe you that it works? But then secondly, when we could not explain the mechanisms, they thought it was voodoo medicine or snake oil or a trick. But now that we can explain the mechanisms of action more fully, for example, we have lasers being used at the pain clinic at Duke University in the United States. This knowledge of the mechanisms also helps us to optimize parameters for studies, so researchers can more efficiently develop studies in photobiomodulation. And then it also helps to guide equipment manufacturers. I am the medical director for Sumis Medical Laser. I've been in this position for 20 years. And it helps us, knowing how mechanisms work, it helps us to build equipment so that clinicians can get the most important thing. What is the most important thing? The clinical outcome. And I think you would agree with me on that. The most important thing in your practice is the patient comes to you with a problem. After your treatment plan with them, how are they? How are their pain levels? How are their activity levels? How are their sleep patterns? You want all of those things to improve. So we have built equipment that is very easy to use. Laser technicians or laser nurses can use the device to safely and effectively deliver Class 4 laser therapy treatments. So yes, the previous slide was very, very complicated, but also just to summarize it in 3 quick bullet points. So when someone is using Class 4 laser therapy in a clinic setting, we want everyone in the staff, all the staff members, everyone in the clinic to simply say, we are creating better blood circulation in the tissues, we are getting more oxygen released from the bloodstream, and we're helping cells in the body produce more energy. Those 3 simple bullet points help patients understand how this modality is working. The outcome of the treatments, again, 3 quick and easy bullet points. It helps reduce pain, it helps to resolve inflammation, and it helps to accelerate tissue healing. So, any condition in the body involving pain, inflammation, or tissue damage can potentially benefit from Class 4 laser therapy. And if you think to your last week in practice with the patients that you saw, how many of them had pain, inflammation, or tissue damage? And usually the answer is all of them. I love what I do for a living. I love traveling the world and visiting with doctors from around the world. But if by chance my boss changes his mind and fires me tomorrow, I would set up a clinic and every single patient that came to see me would receive class 4 laser therapy treatments. Now I know that we have many different adjusting techniques in chiropractic, and you may be doing other things in your clinics. I call class 4 laser therapy the popular kid on the school playground. If you remember back to when you were a child in primary school, at least my experience was, there was always one kid on the playground that all of the other kids liked, and all of the teachers liked them. Class 4 laser therapy is similar to that. So whatever other adjusting techniques or other procedures you do in your office or other modalities that you use, class 4 laser therapy plays together with them very well. And actually, I could spend 2 hours talking about how these things work well together. It truly is a synergistic effect. In other words, 1 + 1 = 3. And we see that, again, with all of these modalities and treatments. For example, in regenerative medicine, the use of stem cells or PRPs, the orthobiologic injections, there are studies that show that healing with the stem cells is good, healing with laser is good, but when you add them together, they have a synergistic effect. Now, what is class 4 laser therapy? We are using a higher powered laser device, and what we are able to do is this. We can deliver a therapeutic dosage of red and infrared laser light to a larger volume of tissue and to deeper targets in a short treatment time. Again, the treatments using that red and infrared light are non-invasive. We are not breaking the skin. Treatments are very soothing and relaxing. Now, I always like to tell stories and jokes. In my chiropractic office, I did a lot of flexion distraction technique. So I had the Lloyd table, the Lloyd Galaxy McManus high-low table, and the patient would be laying face down on the table with the machine automatically moving, and I would be lasering them at the same time, and sometimes they would fall asleep. It was so relaxing. Now, at first, I thought that to mean that I was a boring person, but then I realized that the laser treatments were so relaxing for them. To put it into a diagram or to work through the numbers, if we simply compare laser treatment with a class 3B laser, let's say it's 500 milliwatts, and we'll compare that to a class 4 laser of 5 watts. Class 4 simply means that the power is greater than 500 milliwatts. If we work through the calculations, and if we are wanting to apply a treatment dosage of 5 joules per square centimeter, in the same time, with the class 3B laser, we could treat the 3 isolated red dots that you see, for example. But in that same 5 minutes, we could apply laser therapy to the entire red shaded section. The benefits that you get with photobiomodulation are when you have photons of light being absorbed by the cells. So this is why I always will say that class 4 laser therapy will give us better clinical outcomes, the most important thing. Another way to look at it is this. Imagine if you have a domed sports stadium and you turned off all of the lights in the stadium and you suspended a 40-watt light bulb in that domed stadium. That's somewhat like treatment with a lower powered laser. Some people will argue, well, I'll just use a longer treatment time. But imagine that 40-watt light bulb in the domed stadium. If we simply leave it on long enough, will the entire stadium light up? No, it won't. So when we want to effectively get light deeply into the body, get the photons absorbed, and treat large volumes of tissues in the body, we must use class 4 laser therapy. So, a little discussion of the indications and applications. Remember, pain, inflammation, tissue damage. Here is a summary of some of the conditions that can very successfully be treated with class 4 laser therapy. And you see my list there again. Pain, inflammation, damaged tissues, soft tissues, acute injuries. The laser can safely be used on the head and over the brain. One treatment that is very successful, and I will show you a case of this later, is Bell's palsy, facial nerve paralysis. There are many conditions that can benefit from laser therapy that modern medicine does not have an answer for. For us in the United States, when a patient with Bell's palsy goes to a medical doctor, they are told you can expect to have this for 6 months or even for the rest of your life. With treatments with the class 4 laser therapy, we are able to get those patients asymptomatic and restore function of the nerves and the muscles. Now, I have to admit, I am the biggest fan in the world of class 4 laser therapy, but there are challenges sometimes. Chronic conditions are going to require a longer course of treatments. And then if the patient has health complications, such as diabetes or obesity or things of that nature. However, we still are able to move the needle on them. We can help those patients. And as silly as it may sound, I have been asked over the years about patients with birth defects or genetic disorders. For example, my niece was born with her left upper extremity stopping at the elbow, so she has no left forearm, hand, or fingers. I could laser her every day for the rest of her life. I'm not going to make that limb regrow. Okay? So any type of birth defect, it would either need to be corrected surgically or the patient would have to live with it, such as my niece. And then genetic disorders such as Charcot-Marie-Tooth syndrome. We can laser patients with CMT. However, we're not going to change their genetics. We're not going to cure or fix that problem. So we can laser patients with various genetic disorders and make their lives more comfortable. Another genetic condition that patients enjoy getting laser treatments is Ehlers-Danlos syndrome, the very loose ligaments and loose connective tissue throughout the body. I will show more videos later on about delivering treatments, but a good general way to approach it is to think somewhat like a chiropractor. If we have a noxious stimulus, pain in the body, yes, it will help us if we laser over the nociceptive nerve endings at the area of injury. And I am just using this image of the hand and the spinal cord and the brain just as an overall overview. Now, what we also find is that if we laser over the nerve supply to the area, we can have a direct effect on both the sensory and the motor nerves. For example, there is a study showing that if we lasered only over the dorsal root ganglion, it did have an effect on low back pain. Also, if a patient is having a problem in the extremities involving motor nerve function, again, by lasering directly over the spinal cord, we can have an influence on that motor nerve activity. Next, we'll take a look at published studies on photobiomodulation. And, first, not to get into much of a political discussion, but for us in the United States, healthcare is largely driven by the pharmaceutical companies, Big Pharma. Big Pharma donates lots of money to medical schools for medical school funding. They graduate students, doctors of medicine, and then those doctors of medicine go on to prescribe the pharmaceuticals, which makes money for Big Pharma, which can donate money to the medical schools. So there is a lot of money involved in that process. Research in photobiomodulation has always been a challenge. It's very expensive to do and can take a lot of time. Now, I am happy there is more research being published on this topic, but many times we are stuck down at that level of the anecdotal reports, the case reports, and case series. But we are getting to see more and more published studies moving up the pyramid of evidence. Again, I know that you cannot read this study, but to share some optimism, we are seeing more and more photobiomodulation studies appearing in high-impact journals, such as The Lancet, Pain, Annals of Neurology, Diabetes Care, so on and so forth. So the world is waking up to the benefits of laser therapy for patients. And another bit of optimism is that in the last several years, there have been an exponential increase in the number of studies published. Just a survey of some of those. This was a landmark study because it was the first photobiomodulation study published in The Lancet, the journal of the British Medical Association. And this study showed Laser reduces pain immediately after treatment in acute neck pain and for up to 22 weeks after completion of treatment in patients with chronic neck pain. So there, showing the evidence that photobiomodulation does have mechanisms to help our patients with neck pain. Another, showing that laser therapy significantly improved pain and disability scores compared with controls, so on and so forth. So if you are a person that is interested in reading studies, I do have an online study library where I have collected all of the studies that I have gathered over the last 20 years. I'm more than happy to share that link with you. This one is a small animal study. So many of the studies in photobiomodulation are done on mice and rats and rabbits. What was interesting here is that they crushed the peripheral nerve and they applied laser simply to the spinal cord. They did not laser the lesion in the crushed peripheral nerve. They lasered only the spinal cord. And what they found is that the laser applied directly to the spinal cord can improve recovery of the corresponding issued peripheral nerve. So when we do these treatments, we are not just lasering in the focal area of pain, but again, you will get benefit by lasering directly over the spine in the areas where the sensory and motor nerves feed that part of the body. Again, I'm going to show you a case later of Bell's palsy, but this is a study indicating that laser is an effective modality for patients with Bell's palsy, and showing that higher powered laser therapy had a better improvement than lower powered lasers. And one more, looking at photobiomodulation in peripheral nerve regeneration, finding that photobiomodulation therapy has clinical beneficial effects on the recovery of nerve lesions, especially when related to a faster regeneration and functional improvement. Okay, so to share with you some cases. Again, the laser treatments are very easy to do. Through the years, we have done depth of penetration studies. Now, one question that we always get asked about laser therapy is, how deep does the light go into the body? So, several years ago, we had a very intelligent man who was a PhD in physics working with our company, and he designed a study to look at exactly that. So we used fresh cadaver tissue, and we buried photon sensors at different depths in the tissue. We shined the laser on the skin surface to measure exactly how much light was going into the body. In the early days of laser therapy, any claims of depth of penetration came from the marketing department, not from any scientific basis. So once we had that scientific basis of depth of penetration in cadaver tissue, we could develop protocols that were also based on all of the parameters involved in positive photobiomodulation studies. All right, so let's look at some cases. If this came into your office, what would you do with it? And let me just ask you, does anyone tell your patients, or do you use the RICE protocol? All right. Maybe we need to talk after I'm done here. Because 2 weeks ago, I was at Logan College of Chiropractic, and I gave a 2-hour presentation on innovative care for acute injuries, less RICE and more laser. And so the RICE protocol was taught or invented by Dr. Gabe Merkin in 1978. He wrote the sports medicine book, and he recommended rest, ice, compression, elevation for the care of acute injuries. Now, what you have to realize is that in 2015, Dr. Merkin almost completely reversed his opinion on the use of ice. And if you go to his website now, drmerkin.com, M-I-R-K-I-N, he has a wonderful, highly referenced article that says why ice delays recovery. So when our patients suffer an injury like this, inflammation is our body's natural response to help these tissues to heal. And so Dr. Merkin argues that anything you do to interfere with the inflammatory healing cascade in the body is going to lengthen the recovery time, and the tissues will be weaker. I don't have them in my presentation now, but I could show you the studies that support what I just said. So when a patient suffers an injury like this, ice, taking non-steroidal anti-inflammatory drugs such as ibuprofen, or the use of cortisone injections, anything that interferes with the body's natural inflammatory response will lengthen the recovery time, and the recovery will be not as good. So when we see something like this, if we would apply the laser directly to the patient's ankle, we can and possibly will make it swell even more. So a phrase when we teach laser therapy treatment techniques, we always say proximal to distal. When there is an injury in the extremities, we always start proximal to the injury and work our way out to it. One way to describe it is, injury is trauma to the tissues, which causes activation of the sympathetic nerves, which causes vasoconstriction. So in the treatment of a sprained ankle such as that, we would start our laser treatment at the back of the knee, going around the leg as much as possible and slowly progressing from proximal to distal. And as we move from proximal to distal in the tissues, one benefit is we are getting the release of nitric oxide, which will vasodilate all of the vessels, vasorelax the vessels, and it allows for the fluid to drain out. So proximal to distal. The second key component that we talk about is range of motion. Anywhere we are treating in the body, if the patient can be actively moving that body part, whether it is the ankle sprain, or Bell's palsy, or carpal tunnel syndrome, or foot drop caused by a bulging or herniated disc, anytime we can incorporate range of motion with the laser treatment, the outcomes will be better. So here by lasering in the leg and having the patient do just simple flexion extension within their abilities, the outcomes are going to be better. I'll take questions at the end. Yeah. So that, in the old days with sprained ankles, they would put them into a boot and immobilize it. Of course, that does nothing to address the swelling, and you get the fibrous tissue growing. Thankfully, nowadays, more and more people are realizing that early movement with acute injuries will reduce that fibrotic tissue formation. So here is a case involving a sprained ankle, and there you see the treatment protocols with the laser. This patient was treated daily for 4 days in a row, and it's very easy to see the reduction in the swelling in the extremity, as well as the improvement in the appearance of the tissues. So again, by getting early motion back into that sprained ankle, we are also firing the proprioceptive nerve endings. A big problem with sprained ankles is once you sprain it, you damage the proprioceptive nerve endings. So when you are about to roll your ankle, you don't catch it and you roll it and sprain it again. This is one involving a bruise from being hit by a baseball player. This was a Major League Baseball player. And so if you know the sport of baseball, the pitchers are throwing the baseball 100 miles per hour, and the balls are being batted very, very fast. So this patient was hit by a 92 mile per hour fastball, and there was significant bruising in the area and significant pain. So that was what it looked like before. I apologize, I do not have the post picture, but they did daily treatment for 5 days, followed by every other day for a week, so a total of 8 sessions, using a thigh trauma setting, which is 5 minutes, delivering 2,295 joules of energy, using continuous wave and pulsing frequencies. And so the injury occurred, and the player was able to return to the field of play in 14 days. So in major league sports, in professional sports, or in any level of sport, through my last 20 years of experience with Class 4 laser therapy, that's what I hear from the trainers. The players are able to get back onto the field more quickly. And in baseball, they are paying these guys millions of dollars a year. So it's important for them to get back on the field more quickly. And it's not just from the pain relief. It is because of the laser's ability to biostimulate and repair the tissues. Here is the case involving Bell's palsy. So again, a medical doctor may say that it takes 6 months, or you may have to live with it for the rest of your life. And there you see the treatment being done. Now, with Bell's palsy, the way that we advise doing the treatment is to do laser treatment on the upper cervical spine so that we are targeting the brainstem. So the patient will slightly tuck their chin just to lift the occiput up out of the way. And we do laser treatment side to side in the upper cervical spine. That light has that modulating effect on cranial nerve output, in this case, cranial nerve 7. And then treatment is just done over the pathways, and you may be able to see it in the video that the patient is opening and closing his jaw, he's winking, he's blinking, range of motion. This case I share because it was given to me by a medical doctor in South Carolina in the United States in the treatment of complex regional pain syndrome. And so he goes through the description of it. It's a chronic pain condition characterized by continuing regional pain disproportionate to the inciting trauma. And it quite often affects a distal limb following injury, fracture, or surgery. And so with the patient that he had, he was able to, sorry, on the next slide. The way we would treat this is we would laser the cervical spine. So we are lasering the nerve supply to the area. When we treat in the cervical spine, and I will show you a video of this later, we want to make sure that we come around to the anterolateral cervical spine so that we are shining the laser directly on the nerve roots, getting into the IVFs, and then we would continue on down the brachial plexus. But with complex regional pain syndrome, we also want to have a modulating effect on the sympathetic nerve supply to the extremity. So we would want to make sure that we do apply some laser directly over the stellate ganglion. And I'm sorry, I don't have it in the slide here, but it was 3 visits a week for 6 weeks, and the patient was fine. So again, some of the conditions, some of the patients with complex regional pain syndrome, they're with it for the rest of their lives, and modern medicine does not have an answer for it. So that's a phrase that we use quite a bit. Quite often, classical laser therapy can be a solution for which modern medicine has no answer. One of those that we are seeing in the United States is peripheral neuropathy, whether caused by diabetes or chemotherapy, idiopathic. We've even had a case involving exposure to Agent Orange, the defoliant used in the Vietnam War. That patient had significant neuropathy, and the laser treatments were able to restore proper sensation in his limbs. So it's very rewarding when we can help these patients. Again, the most important thing is the clinical outcome. When we can help them with a non-invasive treatment that has no side effects. So if a patient does have diabetic peripheral neuropathy, quite often they are given gabapentin or opioids or Lyrica or other medications. And we've had patients tell us they didn't like taking those because it made them feel fuzzy, it made them feel weird, and it really did nothing to manage their symptoms at all. So with the laser treatment being applied to their back and to their lower extremities, we were able to get significant relief for them. Now, also, I'm going to show you a case here, and let me just warn you, there is a wound here. So if you are sensitive to seeing wounds, feel free to close your eyes or look the other direction. And I show this I'm not arguing that chiropractors should be wound care specialists in your office, but the ability of laser therapy to significantly help patients with wounds is a big deal. And so the way that we practice chiropractic in the United States is, in our office notes, we would document we are using the laser for pain. So anytime that there is a wound, the patient also has pain in the area. So we are very specific in saying that we are using the laser for pain. Now, we may also document in our notes or take pictures to show what it looks like. You know, a patient has a 2 centimeter by 5 centimeter wound in this area, something like that. But we have to be careful in saying that we are not using the laser for wound healing. Okay, going to show you the picture. This is a patient's ankle, and she was working, they were laying tile on a bathroom floor, and someone across the room was cutting tile, and a piece of it flew off and hit her in the ankle. They did do x-rays, and they found 5 small fractures of some of the tarsal bones. But then later, this wound developed. Now, when I say that we have a solution that modern medicine doesn't, she went to her medical doctor, to her orthopedist, and also to a wound care specialist. And they all told her, you have to live with this. You have to let it heal. Well, it had been non-healing. It had the picture on the left it had been looking like that for about 12 weeks. So it was a non-healing wound. So she went to one of our chiropractors that does have a laser. Again, he's using the laser for foot pain, etc. Applying the treatment from proximal to distal down the extremity to improve that distal circulation. And you see the improvement. Now, it's important to note, there's a lot of necrotic tissue there. They did not debride. They did not remove the necrotic tissue. It was the ability of the laser to stimulate circulation and the cells involved in tissue healing and cleanup to get this relief. So there you see from April 9th. And then the most recent picture that he sent me was from May 6th. So that was a big deal for that patient to get this wound healed in this way. All right, we'll take a look at laser treatment delivery. And again, we have lasers being used in all sorts of professional sports, Olympic sports. This is Olympic heptathlete Anna Hall. She is getting treated by her chiropractor in Florida, and the athletes love to get laser treatments. Now, do any of you care for athletes at any level? The one thing to note about these treatments is it's a healing modality. All right? In the early days of laser, we would think that laser treatment right before a competitive event would, by increasing energy production in the cells, that it would make you almost superhuman. It would make you faster, stronger, with more agility. But we tried that. One of our colleagues tried that on his son before he played a game of lacrosse. And he lasered him, and afterwards, after the match, the son came back to his dad and said, "Dad, don't ever do that to me again." And the reason being is that laser therapy is a healing modality. We are getting that balance between parasympathetic and sympathetic. So by giving the laser treatment immediately before the competition, his parasympathetic system was more active. Now, before you compete at any sort of level, the coaches yell at you. You yell at each other. You get all fired up because you want your sympathetics to be good and strong, so you are ready to fight and be fast. Now, our advice that we give is, if you are taking care of an athlete, have a 24-hour window. Laser them, make sure that there is 24 hours before the competition, and you stop your laser treatments. But then after the competition, immediately use the laser. Going back to talking about Major League Baseball, the pitcher is throwing that ball very fast, 80 to 100 times every game. And in the old days, Rice protocol, we would see pitchers sitting on the bench with bags of ice on their arm and their shoulder. Now we don't see that anymore, because I think all of the athletic trainers have learned the message, the update from Dr. Merkin, that ice is not good on acute injuries. So I suspect, and I need to talk to some trainers about this, it would be ideal if that pitcher came out of the game, went down into the training room, and got a good laser treatment right away. Laser treatment delivery. Again, I said that laser treatment, we always deliver it from proximal to distal. So I always look for analogies and ways to tell stories. I love the game of American football. This is Coach Knute Rockne. He was at Notre Dame. And many of the players, like especially the linemen and the linebackers, if you know what I mean, their elevator did not go to the top floor. They were not the sharpest knives in the drawer, if you know what I'm saying. So Knute Rockne just kept everything very, very simple. And he would just always tell them, boys, football is blocking and tackling. So I borrowed that phrase, and I just say that class 4 laser therapy, it's proximal to distal and range of motion. Anytime you can incorporate those two simple concepts into your treatment delivery, your outcomes will be better. Now, I'm not calling you all a bunch of dumb football players. You're excellent doctors, but keep it simple. And I emphasize that because I've seen people who are new to laser therapy and they are wowed by the technology and they think that it's highly sophisticated. And it's not. Just keep it simple. So why do we treat from proximal to distal? We want to make sure that we are addressing the source before the symptom. Pain and inflammation are often driven by proximal structures, again, lasering over the spine, the dorsal root ganglia, and dealing with central sensitization. If you treat those areas first upstream, you get that inflammatory signaling before addressing the distal side of the symptoms. And then as we treat from proximal to distal, we will follow the nerve physiology. So we follow the pathways of the nerves. That's true for peripheral neuropathy, carpal tunnel syndrome, complex regional pain syndrome, etc. So we always start our laser treatment closer to the core of the body. A couple of other reasons are that we want to prime that arterial blood flow. Now, when you have that injury in the distal extremity, or that condition in the distal extremity, by applying the laser from proximal to distal, we are getting more blood flow moving to that area. In the early days of use in veterinary medicine, they were skeptical and shy about using the laser after surgery. Because when we told them about the priming of the arterial blood flow, they were worried, and it makes sense. If they did the surgery and then they applied laser, they were worried about the wounds bleeding more. But you have to realize that there is an additional benefit. We're also opening up the lymphatic and venous drainage pathways. So with the sprained ankle, when I'm telling you to go from proximal to distal, from the knee down to the ankle, the main thing is we're opening up those pathways to allow for fluid to drain out. And now in veterinary medicine, laser is standard of care. They do a surgery, they close them up, whether they use stitches or staples to close the incision, a laser nurse will laser the area immediately. And the wounds will hold together better because laser stimulates the alignment of collagen fibers. The patient gets pain relief and relief from the inflammation. So just to show you a few treatment videos being done, again, we can laser directly over the spine, just a general treatment on the cervical spine. Just keeping the treatment wand moving slowly. The patient may feel it get a little bit warm, but again, going back to the sprained ankle, proper treatment for a sprained ankle, there is no heating of the tissues. So I think we would all agree, acute injury, do not put heat on an acute injury. In the proper settings used for the treatment of a sprained ankle, there is no tissue heating. Then, range of motion. So I lasered her for a couple of minutes, and now she's just going to do simple range of motion within her level of comfort. And especially when you do the cervical spine, quite often the patient will comment, wow, it feels looser. I can move, I have better range of motion. I can move it more easily. And it makes sense because if there are tight muscles in an area, we all remember that it does take a molecule of ATP to contract an actin-myosin bridge, but it also takes ATP to relax a muscle. So by lasering the area, stimulating the circulation, getting more energy produced by the cells, we're able to relax the tight muscles. And here just demonstrating the technique in the lower extremity, going proximal to distal and circumferentially around the extremity as much as possible. And the reason that we do this is, with the bone in there, laser does not penetrate through bone very well. It will penetrate through the skull. We get about 3 to 8% of light passing through the skull. But when we are treating in the skeletal system, a large amount of that light is being blocked. So by going around, we're targeting all the tissues and the structures in the extremity. And then again, range of motion. Just simply moving the joint. Doesn't have to be anything complicated. Just simply moving the joint. In the knee joint, the posterior approach is the best to get laser directly into the joint. So depending on what the patient presents with, you would laser different tissues. And then again, just showing treatment technique in the forearm. This can be somewhat effective for patients with, again, with carpal tunnel syndrome, trigger finger, Dupuytren's contracture. We would always start the treatment at least at the anterior elbow and work our way down the forearm. And to summarize this is what we're able to do. I have some time left. That's the main part of what I wanted to share with you. I appreciate you all for being very, very attentive. Did you have a question? Yeah, so the treatment itself, let me go back to that slide. The treatment itself is 4.5 minutes on the leg and then 3 minutes on the ankle and foot. And when you do this properly, I have seen it happen 3 times. You're doing the treatment down the leg, the patient is moving their ankle, and the swelling in the ankle will look like a balloon deflating. It will actually decrease in size in front of your eyes. I do have another case that I can show that to you, that it does decrease significantly. Yeah, so in this case, it is only 7.5 minutes of treatment time. Question in the back. Yeah, how many days, like every day? Oh, of the light. Yeah, so that's a whole other topic of photobiomodulation research. And so in the protocols in our lasers, we will use a combination of continuous wave and then pulsing at different frequencies. If you're familiar somewhat with the history of laser therapy, there was the Laser Therapy Handbook written by Jan Tuné and Lars Hode. And in there, they did have a nice section that talked about the benefits of pulsing frequencies. So when we started building our lasers, we based it largely on the reports from Tuné and Hode. They're like pioneers in laser therapy. And then now, there are some studies that are giving us some help, but another way to look at the stimulation of ATP production. Cells in the body absorb light, or absorb photons instantaneously. When we shine the laser on the tissues, those photons get absorbed. Now, processes in the body happen very quickly, but it still takes a little bit of time. For example, in the electron transport chain and you know, the passing and all of the components involved in the citric acid cycle, it does take about 1 to 5 milliseconds for that process to happen, which translate to, if we are pulsing the light between 100 and 500 hertz, 100 to 500 pulses per second, it's kind of like we are pushing a child on a swing. You know, when you push the child on the swing at just the right time, they will swing higher and higher. And so there is a Russian physicist named Tina Karu that wrote extensively on the importance of the dark period, which means you flash the light on the tissues and then those couple of milliseconds in between. So you're giving the body light, you let the body work with it. Give the body light, let the body work with it. And you're doing that, you know, again, 100 to 500 times per second. Now, if you are into any of the techniques involving muscle testing, we have had some doctors, you know, applied kinesiology, George Goodhart and all of that. Some doctors will use the concepts from applied kinesiology and they will find their own pulsing frequencies that will benefit conditions. Another way to look at this concept, are you familiar with the Nogier frequencies? Have you heard of those? Physician Paul Nogier. So he found that there are different frequencies in the body that will address different tissue types. So there are many different ways to approach the concept of pulsing frequencies. And so our protocols are rooted in what Tuné and Hode found, but then we have blended in their clinical experience from doctors who used our lasers extensively and what gives us the best outcomes. Yes? Pregnant women. Yeah, glad you asked. So again, with the time we have here, I did not have an extensive list of contraindications. I have 2 daughters. Don't make me get emotional here. They are 26 and 23 years old. Okay, if and when I'm going to become a granddad, I will laser my own daughters because red infrared, non-ionizing light, I know depth of penetration, I know mechanism of action, so I will laser them anywhere in the body, even if they have low back pain. If it is a regular patient in your clinic, you must have a conversation about it. And if she or her husband, spouse, or anyone in their family, if they are nervous at all about it, then don't do it. Now, we have been giving this advice for 20 years. I'm not aware of any adverse incidents. what you have to look at is the baseline rate of miscarriages. Sadly, some pregnancies end in miscarriage. It's about 10 to 15%. So if you laser her today and she has a miscarriage tomorrow, will she blame you? The baseline rate of birth defects in the United States is 3%. So if you laser her and she gives birth to a baby with a birth defect, will she blame you? One thing that helps us scientifically is that there is a recent published study from Australia looking at carpal tunnel syndrome in pregnant women. And they did use class 4 laser therapy on them. So the entire patient population is pregnant females, no adverse effects whatsoever. Yeah, so it's more of a legal and liability issue than it is a scientific issue. Yeah. Cancer is going to be about the same answer. Yeah, yes. If any of my friends or family has cancer, and that's one, if you want to read much more deeply in this, I do have the studies in my study library. So 20 years ago, we were worried about growth of tumors, metastasis, and yeah, we were scared. So back then our advice was, don't ever laser a patient with cancer. But as time has gone on, first off, there is a published study on chemotherapy-induced peripheral neuropathy. So the patient population, they are all breast cancer survivors. They had chemotherapy in their legs, and the laser was shown to be 90% effective at reducing their symptoms significantly. So there, you have patients with a history of cancer. But now, again, relying on the top experts in photobiomodulation, it's called the World Association of Laser Therapy, WALT. And they have published a position paper arguing that photobiomodulation should be used for the side effects of cancer treatment. So when someone is getting cancer treatment, they will get oral mucositis, peripheral neuropathy, digestive issues, dysgeusia, all sorts of problems throughout the body. And these experts from WALT argue now that laser should be used on side effects of cancer treatments, active cancer patients. So it's the cancer and the pregnancy answer, they're very similar. If a friend of mine, I will laser them. And what's interesting is there is a small animal study. They induced tumors in rats and lasered them, and the tumors actually shrank in size. And they suspect that it was because of the increase in oxygen to the tissues, stimulation of a local immune response. Okay, so yeah, same thing. Friend or family, yes. Regular patient, you have to have a conversation and show them the studies and talk about that. Yep. Question in the back. Yeah, so used improperly, of course, yes. Yeah, and when I first got a device like this, the first thing that I did, because I wanted to know this, I did intentionally burn myself. But let's compare it to chiropractic. If you do diversified adjusting in thoracic spine, if you whack too hard on someone, you can break their ribs. With therapeutic ultrasound or with any modality used improperly, there can be problems. And that's why it's important to have, first off, having the preset protocols in the machine is a safety measure, but then also having thorough training in how to use the device is important. Yeah. Any other questions? Yes. Yes. Yeah. So that's a question I get asked a lot, usually from the female staff members in a clinic. They want to try working on the wrinkles in their crow's feet. So when if you ever do a treatment on your face, you will notice that your skin does feel a little bit tighter. I am 127 years old, but I don't look it, do I? But yeah, it will. But however, for personal use or staff use, I'm okay with it. I would not charge a patient for that, just because it can help with tightening up of facial wrinkles, but it's not what we lead with in doing these treatments. All right, so if you have any more questions or would like to visit, sorry, one more. Yes. Yeah, that's something whenever I get asked that question, I want someone to write the protocol book on it. You know, I'm a laser guy. I am somewhat aware of shockwave. Now, in the US, we do have many clinics that will use shockwave together with laser. Just in general, they will say if that shockwave treatment was painful, if they laser it afterwards, then the patient does have pain after the focused shockwave. Another way, just a simple way to think of it, is that if you have, chronic injuries or chronic injuries to the tendons or whatever, the shockwave kind of breaks it down, and laser helps to build it back up. And so many clinics are using the two treatments together. So yeah, it's the book is not written on that, but I guess the main thing is for doctors that are using the two of them together, again, they notice a nice synergistic effect. And just to go on the segue of a book, I've been doing this for 20 years. I love what I do. I love my job. I love people. I love traveling the world. I've been to 23 countries around the world. There are many books on photobiomodulation. This is the first in the world on class 4 laser therapy. So if this topic interests you, right now there is a link on my website to purchase, and we have one sample copy at the booth. So I am here with our distributor from Switzerland and Germany, also the Baltic states, Elanis Medical. You can see us right in the middle of the exhibit hall. So if you have any more questions or want to talk to the gentleman, Conrad and Andis from Elanis Medical, come and visit us at the booth. Otherwise, I love talking to people. So whether it's laser therapy or chiropractic or just life in general, stop by and we can chat. So. No, we're good. Oh, sorry. Right, yeah. So ADHD, autism, other brain-related disorders, that's kind of a developing topic of the use of the laser. And just basically, again, a small amount of the laser will penetrate through the brain. It's proven to improve cerebral blood flow. But what is also interesting is that it seems to stimulate the brain's glymphatic system. Now, when I was a student at Palmer, the glymphatic system, the drainage system of the brain, was not even discovered. So I suspect when we are doing treatment on these kids with ADHD or autism, one thing that we're doing is stimulating the glymphatic system to drain garbage and toxins out of their brain. Another interesting aspect is if you set the pulse frequency to the brain waves, you have brain waves to alpha, delta, theta, etc. If you set that pulsing frequency to the desired brain wave that you want in that patient, the pulsing of the laser light can help to entrain that activity. So I do that on myself. My regular routine when I'm at home at my desk, the first thing that I will do is use laser pulsing at 40 hertz. So I'm stimulating the higher level, the gamma waves, and there are studies to indicate that transcranial photobiomodulation does improve executive function. Yeah, so that's an interesting area. Now, with that, you would think about what part of the body, where do you want, or what part of the brain, where do you want to be lasering? So you need to have some knowledge of functional anatomy. Yeah. Okay. Thanks for being here, folks. I really appreciate it. Again, the Elanis booth is right in the middle. Yeah, thanks.